Hi, it's Dr. Schmitt at Alabama Weight Loss Surgery, and I want to talk to patients who have the LapBand. LapBands kind of came and went. The LapBand seemed like it would be a great procedure, and my partner, Dr. Miles, was the first surgeon in Alabama to do the LapBand, and later I was the first surgeon in Alabama to do the Realize Band. And that tells you how popular they were, because LapBand came first, and then they got competitors, and Johnson & Johnson, their division called Ethicon, came out with the Realize Band. They no longer make the Realize Band anymore. Probably 15 years ago, bands peaked with about 30% of all weight loss surgeries, maybe a little more, being gastric banding. Last year, probably less than 1% of all weight loss surgeries were gastric bands. There are some people who love their band. About, I would say, 1/4 of patients love their bands, and it helped them lose weight and keep the weight off, and they're not having any problems with them. However, 3/4 of patients don't like their band. They didn't lose the weight they wanted to lose, or they may be having complications of bands. Unfortunately, insurance companies are not very nice, and they always try to restrict benefits because they want to take your premiums every month, but they don't want to pay back for you to get the care you need. If you have a gastric band and you want it removed, they will only pay to have it removed under very certain specific situations involving complications. So if you just say, well, I have some pain at the port side, it didn't work for me, I don't like the idea of it being in my body for another however many decades, when it's not working, I want it out, insurance won't pay to have it removed. If you have certain complications such as band slippage, band erosion, they will pay to have it removed. A lot of people have the band and they didn't lose the weight they wanted to lose, and they want to convert to sleeve. That is a great operation. Generally, insurance won't pay for 2 weight loss surgeries in a lifetime. It's like, they'll pay for your spleen removal once, but they won't pay for it twice. They just say it's a once in a lifetime thing. I think that makes sense with a splenectomy, because you only have one spleen. Doesn't make sense with weight loss surgery. If the surgery didn't work for you, if you regain weight, I think you deserve another chance with a better operation. Sleeve gastrectomy is a better operation than gastric banding. Much, much, much fewer complications with sleeve gastrectomy than gastric banding, and much better weight loss. So conversion from gastric banding to sleeve gastrectomy is something we do quite a bit of. Insurance will not pay for it. You would have to pay for it on your own. I would love to talk to you about it in the office if you want to call and make an appointment for a consultation, and you could have a consultation over the phone if you like. The website is alabamawls.com, and our number is 205-838-3047.